everybody, I am Dr. Michelle Weeks, and this is the first session of our pelvic rehab program. So this is 12 weeks long, and the goal is first to create an awareness of our pelvic floor and how it's connected to the rest of our body. And then we want to make sure that we are able to relax and contract our muscles appropriately and coordinate them as well. And so that really is going to help us to heal our pelvic floor and to achieve optimal function. So today, really what I want to do is just give you a very, very quick overview of our pelvic floor anatomy. We're not going to get super in-depth today to all of the structures, but I just want to point out a few things that are going to help with our initial class today. And then we're going to do a little bit of breath work to really connect to our pelvic floor, and some stretches and some ab and hip strengthening as well. So I'm excited to get started. First off, we have our pelvis here, okay? And what's really gonna be important today is that we have our pubic bone, which is the front part of our pelvis, okay? And then as I rotate this up, we have these two bony parts right here. Those are our sits bones or our ischial tuberosities. Okay, so that's where our weight should primarily be if we're sitting in a good posture. Okay, and then the back side here, we have our tailbone or our coccyx, and then just above that, where our fused vertebrae are, this is our sacrum. Okay, so all of those structures are going to be really important for today's program. Okay, so next we're going to go back to these sits bones here, and what you'll notice is there's a structure, there's a muscle that comes and attaches one side of your sits bone to the other. This is called our superficial transverse perineal muscle. And our perineal body rests right in the center here, okay? And so what this is it helps to form the borders of both our urogenital triangle, which is in the front, and our anal rectal triangle, which goes towards our back, okay? Towards our tailbone. And so that bisects and becomes part of both triangles. What we want to focus on today is not the triangle shape, but both together is going to make our diamond. Okay, so today we're going to use some imagery and some colors with that to really visualize the diamond shape in our own bodies. Okay, so the line from our pubic bone down to our left sits bone, back to our tailbone, up to our right sits bone, and then back to our pubic bone. Okay, so that's the diamond shape that we're going to be referencing today. The other shape that we're going to reference today is a figure 8, okay? So this obviously is our female pelvis. I don't have our male pelvic model with me, so I apologize to any of the men that are watching this. I really do like to make sure we have the demo for the correct anatomy. But for the purpose of what we're doing today, this information is going to be the same for you as well, okay? So you have the perineal body, you have that superficial transverse perineal, our borders are all the same, okay? The next shape that we want to think about is starting at this perineal body, and it's drawing a circle around our anus, going back and attaching to our tailbone, and then back around to our perineum, and then another circle that's going to come from our perineal body, okay, to our pubic bone, back around, okay, to our perineal body. So those two circles together are going to be our figure 8 that we're going to be talking about today. So the figure 8 and the diamond are our two shapes that we're going to be referencing. Okay, we're going to talk a lot about our sits bones, our pubic bone, our tailbone, and then a little bit of that superficial transverse perineal muscle. Okay, so now we're going to get started. I'm going to put this off to the side. I want you all to find a comfortable place to sit. So it can be on the floor or in a chair for this first exercise. We really want to be able to find a good neutral sitting posture. So what I want you to do to start is I want you to put one hand on your pubic bone in the front, and you're going to take your opposite hand and you're going to put it on your tailbone. So what you should notice in this position, if you have good neutral posture, you should have equal weight on your sits bones or your ischial tuberosities, okay? Your tailbone should be off the floor, okay? So if you're kind of rounded back like this, you're probably squishing your hand, okay? And you want to bring that forward a little bit and up, okay? So take that weight off your tailbone, have that weight really onto your sits bones. This is a really good neutral sitting posture, okay? So we're gonna maintain this good sitting posture for our first few exercises. So what I first want you to do is we're going to start with imagining that diamond shape. Okay, so you can close your eyes if you need to really help with that imagery. You can imagine a color if that's helpful as well. Okay, so really what I want you to focus on is drawing that line between your pubic bone. Okay, go towards your left sits bone. Draw the line from your left sits bone back to your tailbone up to the right sits bone, your right sits bone back up to your pubic bone. Okay, so that is our diamond shape. So now what I want you to do is, as we take a really good deep breath in, that diamond should really stretch and expand. And then as we exhale, it should cinch back together, okay? So we're gonna inhale, Stretch and expand. Exhale, bring that diamond back together. Good. Inhale. Exhale. Inhale. Exhale. You're doing great. Inhale. Exhale. One last one. Inhale. Exhale. Okay. Now, what I want to imagine, so just get into a nice, comfortable sitting position, is I want you to focus on your sits bones, okay? And you remember we've got that superficial transverse perineal muscle that's connecting the right and the left, okay? And that muscles should be movable and elastic. They shouldn't be rigid and stiff, okay? So what you want to imagine is as you inhale, that muscle is nice and elastic and stretches and allows those sits bones to widen and separate. And then as you exhale, that muscle kind of contracts and helps to pull those sits bones back together. And you want to exhale until you feel like those sits bones are meeting at that perineal body, which is the center of your perineum there, okay? So once they get back in and meet at that perineal body, then we're going to inhale and let those sits bones expand again. Exhale, bring them back in, meeting at that perineal body, okay? That's an energetic meeting. So inhale, exhale. Feel that expansion on inhale. Everything compact and coming back together on exhale. Two more. Inhale. Exhale. Good job. One last one. Inhale. Exhale. If you're not able to feel these motions, that is okay. I want you just to really focus on seeing that imagery happen, okay? So next thing that we're going to do is we're going to practice our figure eight, okay? So in order to do this, I'm going to have you lay on your back on the floor. You can either have your knees bent up and your feet flat or your legs straight, however you are most comfortable. Everything that we should do should not cause pain. So if you do have pain or discomfort, please stop. Some things I will offer a slight modification for, and that may help to reduce some of your symptoms, but definitely do not push through anything that is painful. We really want to listen to our body and what it is telling us, okay? So I'm going to have you lay on your back, okay? I'm going to have you put your hands onto your belly, and we're going to draw that figure eight, okay? So tailbone around the anus, the perineum, make that circle, okay? And then another circle from your perineum to your pubic bone, all the way back around to the perineum again, okay? So that is our figure eight. So we're going to be in this nice, relaxed position, and then as we take our deep breath in, we want our belly to really expand out. So you're going to breathe. You're going to feel that belly expansion in your hands. Okay. Really notice that that figure eight is separating and widening and stretching. And then as we exhale, our belly comes back in, and that figure eight tightens back up. Okay. You might feel with that exhale that our diaphragm is moving back up into our chest as well. Okay. So inhale. Exhale. Imagine that figure eight widening and tightening. Two more. Okay. Next, what we're going to do is we're going to move into our stretching and some of our activation portion of this session. So what you may need is you may need a block or a pillow or a small ball. And so if you have one of those handy, definitely go and grab that. Okay. So we're going to be using those in this next portion. So first, what we're going to do is we're going to lay back onto our back. I want you to bring your knees up towards your chest. Okay. So for some people, you're just going to bring your hands on to your knees here. Okay. So this is if you're lacking some motion or some flexibility, this is a really good starting place. Okay. For others, what you're going to do is you're going to grab the inside of your feet. Okay. Like so. And then we can do a little bit of a rock side to side. Tailbone should be up off the floor. Really tune in to where you're feeling the stretch with this. Okay, are you feeling it in your hips? Do you feel it in your adductors? Are you feeling it in your hamstrings? You feel it in your pelvic floor. Feel a nice widening and separation. Really relax into that stretch. Let everything go. From here, you can also find your sits bones pretty easily. Yep, so right there. Okay, remember, between these 2 points is that superficial transverse perineal muscle. Okay. So another couple gentle rocks, side to side. And then we're gonna bring our legs back down to the starting position here. Okay, now what you're gonna do is you're gonna grab your block, your ball or your pillow, okay, whatever you have handy, and you're gonna place that between your knees. Okay, so now what we're gonna work on is a little bit of a pelvic tilt. Okay, so what you're gonna do first is you're going to push your feet down into the ground, and this is going to cause your spine to really push down into the floor. Okay, we're going to do that with our exhale, and then as we inhale, we're going to round, we're going to kind of arch our back up, so our tailbone's really going to push into the floor. Our ribs are going to come up, okay? And then we're going to exhale, and push our feet into the floor, spine into our floor, inhale. Okay, so if you're imagining like you're balancing a cup of water on your belly as you're doing this, okay? As you inhale and your tailbone comes up, that water is going to dump towards the floor and towards your feet. As you push your legs down and your spine goes into the floor, that water is going to dump and pour onto your chest, towards your arms. Inhale. Exhale. Good job. These should not be painful at all. If it is, decrease your motion and just a little bit. Two more. Good. This time we're going to add a sound on the exhale, and we're also going to gently squeeze whatever you have between your knees at that same time. Okay? This time we're also going to find a neutral pelvis. Okay? So imagine if you are balancing a cup of water on your belly. It shouldn't be spilling in any direction. Okay? So we want nice and neutral. So what we're going to do on inhale, we're just going to relax. Imagine that figure eight, and it's going to be expanding and widening. And then as we exhale with our, we're going to gently squeeze that block between our knees and imagine that figure eight is cinching together. Okay, so inhale and then exhale. Inhale, relax. Exhale, squeeze and cinch. Three more. Two more. Okay, now you're going to keep that block, pillow, or ball between your knees, and what you're going to do is bring them up into this 90-90 position. If that's uncomfortable on your back, you can bring your knees a little bit closer to your chest. Okay, that should take a little bit of pressure off. So what we're going to do in this position, I'm going to talk you through it first, but you're going to have your hands on your thighs, okay? And as we exhale, what you're going to do, we're going to make our sound with this as well. You're going to push your hands into your thighs, but your thighs are going to resist and be pushing into your hands, okay? So we're going to do that on the exhale. Imagine that figure eight shrinking when you do that. Okay, and then on inhale, we're gonna relax and imagine that figure eight widening and opening. Okay. Three more. Last one. Good. So now what we're going to do is we're going to take